Well, the 5-day isolation period for COVID-19 could be a thing of the past. That said, the CDC has not confirmed the proposed change, but a lot of people talking about this, of course. Dan Gross looked into it for us. He joins us now in the studio with what he found. Dan.
Hey there, Adam. Should the CDC make these changes, they would be the first major changes to the isolation protocol since 2021. We have what both a local pediatrician and a national expert had to say on this potential change. This week, reporting came out that the CDC would change its COVID isolation guidelines later this year. We should say the CDC has not confirmed this reporting so far. The proposed changes, instead of the 5-day isolation period, people would be able to leave their homes if they've been fever-free without the aid of medication for 24 hours. But these new isolation recommendations would not apply to hospitals or other healthcare settings with more vulnerable populations. Dr. Lara Germanis from the watchdog group the People CDC says this proposed change does not follow the science.
Most people continue to be shedding virus for about 9 days with a range of 6 to 11 days. And the more doses of vaccine that you have, younger patients will tend to be infectious for maybe 1 day less than that. Older patients or people with severe disease can shed the virus for a longer time.
New York State is averaging between 100 and 200 deaths by COVID a week since December. Local pediatrician Dr. Edward Lewis says should this guidance be changed.
But in general, we're sort of at a point before things went upside down, and you know, COVID is a virus. Coronavirus has been around for years. It causes really bad colds. Practically speaking, I think a lot of people have been operating under that premise anyways.
Now, this also follows California and Oregon amending their guidelines for isolation. So I asked the New York State Department of Health, who said in a statement they, quote, continue to follow CDC's COVID-19 guidance, and if it changes, so too will ours. Reporting in the studio, Dan Gross, News 8.